Before we start, I want to make sure you're all in the right place. This is the session on public health, planetary, One Health. All right, everyone in the right seat, right plane. Okay, before we begin, let me lay out what the structure of the next 75 minutes is going to be, ideally. I'm going to begin with a short overarching introduction to the topic. I will then introduce our two interlocutors for the day, after which they will each give a presentation individually of under 15 minutes each. We will then have some cross conversation here among our little group. And then afterwards, we hope to leave the last 20 minutes or so to field some questions from you, the audience. At least that's the plan, okay? So let me jump in and start with something painfully obvious, which is that we're all currently obsessed with COVID-19, as we have absolutely no choice but to be, given how dramatically it's impinged on all our lives. And one of the most painful aspects of this crisis, besides, of course, the immeasurable amount of death and suffering and economic hardship it's visiting on so many people, and sadly will continue for a while longer, it's also revealing starkly and nakedly some of the most glaring injustices, some of the deepest structural flaws in our society. Now, I'm not naive, and I assume most of you watching this are not either. We all know that we live in a system that's a weird mix of plutocracy and democracy, and from time immemorial, the rich and the middle class have had better health outcomes and had better health care in the same way they have better educational opportunities than the people at the bottom of the social order. But even the most cynical among us have to be stunned by the numbers, by the extraordinarily disproportionate amount of suffering that's been visited on the most disenfranchised communities, especially communities of color. So one thing that's clearly revealing is the extent to which human health is inextricably linked to the social conditions, the social order, to socio-political factors. That's clear. And we have to hope that our society will take this as a wake-up call and that we'll begin to start addressing these gross injustices in the years ahead, not just in our public health system, but in the broader society. But that said, it's also important to take a step back and to understand that there are broader questions than even just the socioeconomic ones that I just mentioned. And this should be painfully obvious because COVID-19 is a zoonotic disease. And we have one of the world's leading experts on zoonotic diseases here with us today. So we'll get into that in a little bit. But the fact that it's a zoonotic disease, in other words, a disease transmitted from animals to humans, as have so many of the epidemics and pandemics in human history, from the Black Plague through Ebola and MERS and, of course, the common flu. So that's an indicator right there that human health is inextricably linked to the health of the ecosystems in which human beings live, to the health of other species, to the health of the entire biosphere. So that's part of what we're going to be discussing today, is this broadening of the concept of what human health is. Now, about 16, 17 years ago, we at Bioneers wrestled with this question in an early way. We published a book, a collection called Ecological Medicine, in which we attempted to gather a number of voices from disparate fields who were all pointing arrows in that direction of this idea of a need to broaden the concept of public health. We had people from environmental justice movements, people from chemists working on toxicity in the environment, people working on eco-psychology, people working on urbanism issues. It was an early attempt. And since then, there have been, including the two illustrious figures we have with us today, people who have really refined and deepened that understanding and come up with actual battle plans and plans of action around that deeper understanding. So I'm going to rapidly introduce these two folks. Now, I normally don't read extensively from bios of presenters because I figure people can look it up online. But in this particular case, these two gentlemen are so deeply experienced and have such a track record that I feel that it will add to the gravitas of the proceedings if I really get into their bios a little bit. So I'm going to start with Professor Howard Frumkin, who's a physician and an epidemiologist, who's Professor Emeritus of Environmental and Occupational Health Sciences at the University of Washington. Now, Howard has held a lot of positions. He led the Our Planet, Our Health initiative at the Wellcome Trust. His many other positions have included Dean of the University of Washington School of Public Health, Director of the National Center for Environmental Health at the CDC, and Chair of Environmental and Occupational Health at Emory University. He's served on countless boards and advisory committees for all sorts of governmental, scientific, professional, and academic institutions. He's the author or co-author of some 250 papers and 9 books, including Making Healthy Places, Designing and Building for Health, Well-Being, and Sustainability. And one reason that we really wanted Howie, as he likes to be called, I think, on this session, is that he just co-edited a book that we just read a few months ago, put out by Island Press, called Planetary Health. And in that book, we recognized a much more refined and all-encompassing attempt at doing what we had attempted in our book, Ecological Medicine, some nearly 20 years before. And we really felt that, this is someone who's really taken the mantle and run with what we were trying to do. So we felt we absolutely had to have him here. And I recommend that book highly to everyone. So anyway, there's a lot more to be said about Howie, but we're going to leave it there for Howie. So let me now move on to William Karesh, who likes to be called Billy, I believe, but that's his preferred nomenclature. So Billy Karesh is an absolutely legendary figure in really one of the leading experts in the world on zoonotic diseases and on the relationship between human health to animal health. He is the one who is credited with coining the term One Health, which has become a very, very important concept, precisely pointing the way at this deeper understanding that human health is inextricably linked to ecosystem health. But let me read a little bit about first of all, his positions and some of what he's done on the ground. So as his day job, well, it's more than a day job, but he's Executive Vice President for Health and Policy for EcoHealth Alliance, which is an extremely important organization working on zoonotic diseases. And he's part of the USAID Emerging Pandemic Threats Predict 2 program, or the liaison to it for EcoHealth Alliance. And that's an incredibly important program, which of course the Trump administration defunded as soon as it came to power, simply because it was the most important and most significant group of people working on zoonotic diseases on the planet. So anyway, I don't want to get into ranting and raving about this administration. We'll skip that. Billy is also a member of the World Health Organization's IHR roster of experts. He's the president of the World Organization for Animal Health Working Group on Wildlife, and many other things. But one of the things I really want to drive home is this is not some armchair theoretician. Billy traced the origins of bird flu and collected a sample of a virus from a wild swan that was then later used for the human vaccine worldwide. He has led projects in over 45 countries to go the range of the alphabet from Argentina to Zambia. His team proved the connections between Ebola outbreaks and the use of bushmeat in Africa, found the MERS coronavirus in camels in the Middle East, and the closest relative of the COVID-19 virus in bats in Asia. So that's an extraordinary record. We're really excited to have Billy and to have Howard here. I can't think of two people who will be better suited to try to help us expand our understanding of public health and human health. So without further ado, I'm going to let Howard take it away. And then after that, Billy will do his presentation. And then I hope we can engage in some lively conversation. So Howie, take it away.
JP, thank you very much. And Jackie, can we bring the slides up? I'm not going to speak from slides today. And there, I think you can see them now. So it's really an honor to be here. It's an honor to be here with Billy especially. And I think that we'll do a nice 1-2 punch, if you will, because I'll focus on some broader themes in planetary health, including I'll talk about climate change. And Billy, I guess you'll talk about zoonotic diseases and spillover. And I think this will be a nice comprehensive overview of links between our planet and our health. And I'm going to speak from the perspective of planetary health, this emerging field, which I'll define in just a couple of minutes. But let me begin by inviting everybody to channel your inner historian. And, oops, we got a little slide problem here. I want to take you back to the year 1860. This is the bottom of a coal mine shaft in Scotland. And there's a gentleman who is wearing his wig and evidently lighting a pipe or a firecracker or something, which is a nice demonstration of the reckless insouciance that would characterize energy policy for the next couple of centuries. This is coal, as England is exploiting coal on a very large scale, and the Industrial Revolution is moving along. In almost the same year, 1859, the Drake well was drilled in Pennsylvania, becoming the United States' first major oil well. And this, too, was a major move forward in the use of energy. This is what helped initiate the Industrial Revolution in transportation terms in the U.S. Technical issue here. Here we go. Okay. Those two places in the mid-19th century may be the beginning of the planetary health story. What that triggered, as you can see here, is a massive upscaling of the use of energy worldwide. There was a lag of a few decades, but by 1900, 1920, within 50 years, energy use was exploding. And almost all of that is fossil fuel energy, natural gas, oil, and coal, as you can see on this picture, to the point that we are now using vaster amounts of energy than has ever been the case in human history. That energy has been essentially a big party, and it's enabled us to do a lot of things. One of them is to reproduce. Here you can see a 10,000-year tracing of the human population on the planet. You'll see that it began to increase in size in the Middle Ages, but it really shot up as part of this post-industrial revolution population explosion. We've also seen a huge increase in economic activity. This is GDP, not the best measure of human success and prosperity, but a good measure of throughput of energy and materials. And as you can see, it has skyrocketed too. In fact, almost any indicator of the human enterprise, water use, transportation, the damming of rivers, the travel around the world, the number of McDonald's restaurants, you name it, almost any indicator has been skyrocketing in a phenomenon since the Second World War that's called the Great Acceleration. Now, that has led to extraordinary improvements in the human condition. On average, this is the best time ever in human history to be alive. During this Great Acceleration, illiteracy has gone down, infant mortality has gone down, poverty has gone down, life expectancy has gone up, and that is all good. But those gains have come at a cost. The use of energy and the technologies enabled by the energy have led to major alterations in the Earth. The chemistry of our atmosphere is different, with higher levels of carbon dioxide, nitrogen oxide, and methane. The pH of the ocean is different. The use of land around the planet is different. The availability of water and soil is different. All in all, the planet we inhabit is not our grandmother's planet. Here are a few numbers for you. 40% of the Earth's ice-free non-desert surface has been appropriated for agriculture. 46% of the world's original forests are now cut down, a number that is continuing to rise in many parts of the world. About half the world's fresh water is being appropriated mostly for human agriculture. 60% of the world's rivers are now dammed, and that number is rising fairly fast. More than 90% of fisheries are exploited at or beyond sustainable limits, and we are losing species at about 1,000 times the baseline rate of species loss. All of that, as I think everybody on this conference knows, has led to what's been called the Anthropocene, a geological epoch characterized by human control and heavy influence of patterns on the planet. That has also given rise to the notion of planetary limits, the idea that if we push these limits, if we push climate change beyond a certain point, if we push ocean acidification or species loss, that can lead to irreversible and disruptive changes in Earth systems that will in turn redound to human suffering. Now, this is a session on health. So how do all of these planetary changes relate to human health? Well, there are at least two frameworks that help us understand those links, and I want to present two of them. One is the notion of ecosystem services. The idea here is that natural functions can support human well-being in many ways. They can support us through phenomena such as nutrient cycling and soil formation. They can provision us with food, fresh water, and other things we need. They can regulate phenomena that would otherwise threaten us, phenomena like climate and flooding. And they offer us cultural services, such as aesthetic and recreational services. This is the notion of ecosystem services, and they map beautifully to many aspects of human well-being, including but not limited to health. So intact planetary systems benefit us greatly. And at the same time, disrupted planetary systems threaten us. Now, this is kind of a complicated image, but what you'll see here is in several domains, in the atmosphere, in land, in water, and so on, you'll see a red-orange arrow and a blue arrow. And the blue arrow signifies adverse effects on human health. The red arrow signifies disruptions of planetary systems. And the point that I want to show you here is that as the disruptions to planetary systems increase, the impacts on human health increase. So intact nature delivers us ecosystem services that protect and advance our health. Disrupted natural systems, and we have good empirical evidence for this, undermine our health through a variety of pathways. It's those recognitions that have given rise to the idea of planetary health. This is in some ways not revolutionary. This is a reframing of insights that we've had for decades, as JP mentioned, really for centuries if we look back to indigenous knowledge. But the notion of planetary health arose in 2014 with a declaration in the Lancet, the medical journal. A foundation funded a commission which issued a major report in 2015. I was lucky enough to be part of a textbook that came out this year. So the field is now maturing a little bit. It's defined in many ways, and here's a long definition for those who want to read it. But the essence of it is that we link human systems with natural systems. So planetary health, simply put, is the health of human civilization and the state of the natural systems on which it depends. So let's look at one example of how this plays out. And the example that I want to show you is climate change. And I'm using this relatively chilling photo to remind ourselves that disruptions to planetary systems interact with each other. Not one of the issues that we'll talk about today occurs in isolation. Well, I think everybody here is well aware, I showed the slide earlier of increasing levels of energy use over time. That has led to increasing emissions of carbon dioxide because much of the energy that we use comes from burning fossil fuels, which releases carbon dioxide. That in turn has led to higher levels of carbon dioxide in the atmosphere. Picture here on the famous, almost iconic Mauna Loa observatory tracing of carbon dioxide. That has led to planetary disruptions, including rising temperatures, sea level rise, weather extremes, and all of the other natural features, physical features of climate change. Climate change, in turn, threatens human health through a variety of pathways that are inventoried here. Heat causes heat stress, cardiovascular problems, diminished work capacity, and so on. Sea level rise and severe weather causing both acute fatalities and injuries and long-term consequences, including on mental health. Air pollution, all things being equal, warmer weather leads to higher levels of ozone in the air, causing respiratory and cardiovascular problems. Allergies, because it turns out in what must be a divine joke, many of the allergenic plants, such as poison ivy, thrive under conditions of high CO2 and warmer weather. Chemical exposures, because chemicals transit through the biosphere more actively under conditions of climate change. Infectious diseases, about which I want to say not a single word more because Billy knows so much more than I do about that, but we'll hear more about infectious diseases, both vector-borne and waterborne. Threats to the water and food supply, which will threaten nutritional status, already are threatening nutritional status in many parts of the world. Mental health consequences, including the way I'm probably making you feel right now by talking about all of this, and resource scarcity and competition. But actually, this is an oversimplification because the better picture of the effects of climate change looks like this. What you can see here is that there are some direct health impacts, injuries during severe weather events, for example, but many of the impacts of climate change occur through complicated pathways mediated by environmental and social impacts, leading to challenges like increasing food prices, changes in microbial ecology, all of these leading indirectly to a number of health impacts. Let's just dive into one because I want to show you one thing here, and that is complexity, how interrelated things are and how complex this is. So the one issue we'll talk about is the one that may seem the simplest, and that's heat. Around the world, in many parts of the world, people are being exposed to levels of heat, both acutely through heat waves and long-term through a new normal, well beyond the levels of heat to which we are accustomed. Now, heat waves are catastrophically bad. During heat waves, people die, especially the very young, the very old, the poor, and the socially marginalized, and people with certain medical conditions. The numbers can be frightful. 70,000 deaths during the 2003 European heat wave, 54,000 during Russia's 2010 heat wave, uncounted thousands in India during each of the recent summers. Now, people can adapt to heat, but only to a point. And in many parts of the world, the Arabian Gulf as a prime example, levels of heat are reaching the point that exceed human adaptive capacity. But it's not just that people die during heat waves. Heat threatens health in less obvious and numerous ways. So during times of hot weather, episodes of violence increase. There's fairly good evidence that suicide increases during hot weather. Kidney disease increases during hot weather, especially among outdoor workers who don't have access to plenty of fresh water. Foodborne and waterborne infections increase because it's very hard to keep food and water sanitary and disinfected when the weather is very hot. Sleep disturbances are more common in hot weather, and sleep disturbances in turn increase the risk of cardiovascular disease, mental health problems, and other health outcomes. Abnormal birth outcomes increase during hot weather. Academic performance among children in schools decreases during hot weather, as does work performance. People exercise less during hot weather, and sedentary lifestyles, as we all know, are a risk factor for cardiovascular disease, cancer, depression, and other conditions. Workers are affected in several ways. One is that the risk of injuries increases during hot weather. Workplace injuries rise dramatically. And perhaps more importantly, work capacity decreases, aggravating poverty in many parts of the world and all of the health consequences that flow from poverty. So heat is just one of the pathways through which climate affects health, and heat is, as you can see, a very complex, multifaceted pathway. This exemplifies the impacts of environmental degradation and change on human health. Now, there is very, very deeply embedded in all of this an equity concern. This is a picture of carbon footprints by income in the US. And what you can see is that on the right, the wealthiest among us have much larger carbon footprints than do the poorest among us on the left. And this disaggregates our carbon footprints, and it turns out that it's across the board. It's the food we eat, it's the housing we inhabit, it's the clothing and other goods that we buy, it's the way we travel. So wealthy people contribute much more to climate change than do poor people. That's not just a US phenomenon. Here it is globally. You can see that the percentage of CO2 emissions are much higher among the wealthy in the world than among the poor. So the responsibility for climate change rests with those who are well off and intense consumers of goods and energy, but the consequences fall disproportionately on those who are poorest. This is a density equalizing cartogram. The upper picture scales the size of each country by its historical carbon emissions, and the lower picture scales the size of each country by the climate-related deaths just from 4 of the many causes of death related to climate change. And you can see that there is a complete mismatch, with the US and Europe being big and bloviated in the upper panel, and Africa and South Asia being much proportionally bigger in the lower panel. So this is a justice issue that exists both within countries and between countries. Now, I know how you feel. This is all grim news to hear. There are major challenges, but there's a good news story, and I want to finish with the good news story. If we consider the green economy that we need to move toward for the sake of preserving planetary systems, both combating climate change, fighting biodiversity, and so on, here are several elements of the green economy pictured in this image: clean energy, well-designed cities, healthy diets, and green chemistry. I can't talk about all of these in detail, in fact, any of them in detail, but The core good message is that if we take steps toward each of these improvements, we can improve health as well. Wouldn't it be great if, in the process of moving toward clean energy, well-designed cities, and so on, we could tackle the major health threats we face as a society, which are listed here on the right? Well, I've got some good news. Clean energy delivers less heart disease, less lung disease, better health, and so on, mostly but not entirely through the pathway of reduced air pollution. Each of these blue arrows is substantiated by a large body of very solid evidence. Well-designed cities with mixed use, with activity centers, with transit, with pedestrian and bicycle infrastructure delivers all of the health improvements shown here. Healthy diets deliver all of the improvements shown here, less heart disease, less cancer, and so on. And if we move toward designing chemicals so that they are not bioaccumulative, not persistent, and not toxic, then we deliver many of the benefits shown here. So tackling the planetary crisis also delivers far-reaching, widespread health benefits, and that's really good news. In fact, there is no need to despair because there are many reasons for hope, and I want to just close with a comment on hope. The planetary changes I described are grim. I recently spoke to a university audience and asked the students and faculty there how many of them had confronted despair in considering these issues, and every hand went up. No surprise, despair is an occupational hazard for anybody who thinks seriously about planetary changes. But we need to fight despair. It's immobilizing, it's painful, it doesn't accomplish anything at a moment when we have to be about accomplishing a lot. We have to embrace hope ourselves, and we need to inspire hope in others. Fortunately, there's a lot of basis for hope, and if I had 15 more minutes, I would go through it with you, but I will tell you that technology is advancing. Better battery storage, better renewable energy sources. Economics is improving. Renewable energy is cheaper than ever. Policy is maturing. We're seeing carbon pricing and other very far-reaching policies around the world. Activism is blossoming, a cardinal feature of the last couple of years. Public opinion is shifting. Change is happening around the world.
All right. On that optimistic note, were you done, Howie?
Not quite. This is just a summary picture. Planetary Health is this new framework that, as I've tried to show, is people-centered. It is systems-based. It faces upstream and looks for root causes of human health and well-being. It is committed to equity. We look to the future to try to plan enduring, sustainable solutions. We are solutions-driven, and we look very hard to inspire hope. So for those who would like to learn more, here's the book that we just published, which is the first textbook in this field. And here is a website of the Planetary Health Alliance full of good information. JP, I'm afraid I'm going a little over, so thank you for stopping me, and thank you all for your attention.
That was great. Thank you, Howard. I can't think of a better global analysis. But now let's get in the trenches. So, Billy, your turn.
And Billy, it's going to take me just a minute to bring your slides up, so bear with me.
Please do. Allowing Dr. Frumkin here to control my slides for me. Thank you for doing that. And I think my talk will be very similar, actually. We're going to run on a parallel track, and I'll just probably give you a few different examples of many of the same issues. And really kind of focus back on get us back on the pandemic theme a little bit. So you can skip right to the second slide, please. So I'll kind of use emerging infectious diseases kind of as a theme that runs through this. But as we've just heard, of course, what's going on is not limited to emerging diseases or zoonotic diseases, but they give it's a very tangible thing that people can think about. So some of our work over the years has been looking back at what drives emerging infectious diseases. Most of the emerging infectious diseases, a large proportion, are zoonotic and linked to animals, but not all of them are. But when we do a thorough analysis and get an objective look at that, we start to pull out You can map those out, and it gives you a kind of a distribution of where emerging infectious diseases have happened over the decades. But it's very skewed, of course, this is very biased to where research is done, where there's academic institutions, where there's good hospitals, where there's good diagnosis, and where there's good reporting. But if you look at each one of these events, as we've done, and look at what the underlying risk factors are or what the correlations are, if you go to the next slide, you can start to tease out what's behind these emerging infectious disease events, if we want to pick those. We slice this other ways. We've looked at non-infectious diseases. We've looked at antimicrobial resistance. But right now, today, I'm just going to talk about the ones that are linked with emerging infectious diseases. So what we've seen is that last 50 or 60 years, that land use change, food industry, change in human susceptibility, primarily, but HIV/AIDS has really changed the dynamics on emerging disease. And agricultural industry change. And of course, the reason they become pandemics or spread around is international travel and commerce, in addition to the fact that international trade and commerce actually facilitates the introduction of new diseases or old diseases into new places. And that's one of the definitions of emerging disease. So another way to look forward is to actually map out where these characteristics are taking place. And if you look at this next slide, it gives us a very different picture of emerging infectious disease or disease emergence, because this is based on risk factors or the drivers of disease emergence instead of the history. Because as we progress, and you saw that with Dr. Frumkin's slides, things have changed rapidly in the last 50 years. It's not our great-grandparents' planet anymore. What we're doing now is dramatically different. And this maps out kind of where those kind of activities are taking place. Where's the risk for disease emergence, which tells us where we need to focus our energy. And you see, once again, as Dr. Frumkin was saying, there is a disparity there too about where the risks are and where we need to focus our attention. So if you go to the next slide, please. That has kind of led our work into looking where the risks are, where we need to focus on our surveillance activities if you're interested in emerging diseases. So part of this, a lot of our efforts has been in hotspots of emerging diseases. And I'll use the current COVID pandemic as an example, and looking at coronaviruses. And what we've determined, and you can go to the next slide, is a large range of coronaviruses that we've found that are related to SARS, the first SARS, and now COVID-19, SARS-CoV-2, or SARS-CoV-2. And we find these viruses in bats throughout Asia. A lot of our work has been in China, work with Chinese colleagues. And in fact, we found now about 500 different coronaviruses in bats in Asia, and over 100 that are closely related to SARS. And these have been circulating for millennia. And of course, this work's been done over the last decade or so. So they're prevalent out there. Next slide. So completely natural. So kind of our approach, this kind of a systematic approach of looking at animals and looking at people and then looking at what people do is kind of our pathway to that. Identifying these viruses in bats, and then going out and working with local communities and sampling people. That first step is to find out, well, are people exposed? And what we have found is that a significant percentage of people already have been exposed to this group of coronaviruses. And this has been going on for years. So down there in yellow, you see from 0.5% to 3% of people in southern China alone, where we were working, have antibodies to these viruses. So this is an ongoing thing. It's a very natural process. We come in contact with animals more now maybe than before, but I don't know if that's one of the significant differences now. We have more people and we're more disrupting habitats, and we're coming into contact with animals more and more. What does that represent? It seems like a low percentage, 0.5% to 3%. But given the number of people in this region, we estimate about 20 million people prior to the pandemic already had antibodies to this group of viruses. So all it took was one of those people are infected for that virus to change and to become transmissible from human to human. Just like HIV/AIDS, we knew originated in animals, got into people. At some point, it became human to human transmission. So we'd say, is COVID-19 a zoonotic disease? I don't think it is. At this point, it's a human disease. It's going human to human. But it has zoonotic origins at some point in time. We're not sure when that was. It could have been decades ago. Next slide, please. If we map out, then again, the risks. Now we know the bats have these viruses, and where do those bats live? And once again, you can kind of get a hotspots or a heat map for where the risk of those viruses are getting into people, where those bats live, and where there are a lot of people. Where do they come in contact? Once again, where do we focus our effort if we want to do something about it? It's not just an interesting academic idea. Our role, our job, our responsibility is to get out there and reduce the risk and reduce the burden of disease, reduce the risk of new pandemics. So once again, I mentioned that number, 3 to 19 million people already exposed prior to the pandemic. Next slide. One of the things we've been doing is just getting out into communities and doing direct education, informing people how to live safely with bats. We can't just sit here at home and wait for the next pandemic and then wait for somebody to come up with a vaccine and then wait for somebody to pay for that and wait for it to be distributed and then hope people actually will take the vaccine. It's a pretty, response-oriented approach to dealing with emerging infectious diseases. Instead of getting out and having making some investment in prevention. So our one approach is community engagement, teaching people how they can reduce their risk. A lot of people farm bat guano, which is feces for fertilizer. If people are going to do that, they need to be educated to be able to do that safely to reduce their risk of infection. Some people eat bats. Some people go in caves for tourism. There's things we can do to reduce exposure. Can't prevent every infection, but we can reduce risk. Next slide, please. That kind of gets us into this thinking about prevention in general. And we did some work last year about global health security and where the investments are. So we looked across the stream of activities at a global scale and broke down health security into prevention, detection, response, recovery. Everybody seems to be focused on early detection. All the money is in response. If you go to the next slide, you can kind of see, we looked at all the big organizations around the world and where the money was being put into and where their activities were going. And you see everybody loves to do response to an emerging disease outbreak. Everybody shows up. Everybody watches the fire. Everybody comes to watch the building burn down. All the firemen are there. Everybody's there. Very little investment in prevention, a little in early detection. And then recovery is typically ignored too. So once again, after the outbreak, after the disease, everybody goes home. The local people are kind of left poorer than they were before, with less resources than they were before, and they're left on their own for recovery, when recovery is really the first step for prevention for the future one. So you can see this is circular. Next slide, please. As Howie was talking about, it's a bigger picture, and this is the IPBES report that just came out. This is like the Intergovernmental Panel on Climate Change. This was on biodiversity and environment. And you can see the same things going on, the same conversations happening there, because this is all linked together. So changes in land use, the way we're doing agriculture, ecosystem deterioration, and climate change are all linked here to negative health outcomes. Next slide. And then just pulling it in, and this looks very familiar to this slide we just saw earlier about climate change. In fact, it's the same journal it was published in. And looking at some of that about the health outcomes about climate, but this one, if you look at the top, it's about what are the sources, who do we need to engage and work with to tackle some of these problems? And I think that's what Howie was getting to at the end about the solutions. So I want to kind of talk a little more about that too, because in the health community, we're kind of at the end of the garbage dump. So we're dealing with the sick people at the end. And the drivers that are causing this are different sectors in society. So if we don't engage those societies, all we'll be doing is always responding. So, solution for traffic fatalities is not necessarily more emergency rooms, it's better engineering for traffic, better engineering of cars, better laws, better regulations. The way a road is designed can save lives. So we need to think about that for planetary health. Climate, our health is about engineering solutions up front with the industries, the activities that are leading to adverse health outcomes. Next slide, please. There's a lot of talk for emerging infectious disease about wet markets and wildlife trade. We know this is a source of infectious diseases. All are common endemic zoonotic diseases. We're challenged, though, because hundreds of millions to probably billions of people on a weekly basis are getting their food from this type of system. And these systems, of course, are breeding grounds, for infectious diseases and can lead to pandemics. The poultry markets we know are linked to pandemic influenzas. This is bats for sale on the left. We know are linked to Ebola, henipaviruses, these coronaviruses we've been talking about. In the foreground, you see pork. So there's a mix. People are in there. This is going on every day. Hundreds of millions of people are exposed to the system. So what do we do about that? Some people say close the markets. Well, people need to eat, and we need to help that out. That's not an immediate solution. So go to the next slide. We've been kind of taking this approach like, well, what can we do to expand refrigeration? Now, of course, there's some issues about refrigeration, and it means more electricity. But we've really been engaging some kind of innovative approaches in the cold chain logistics industry. For one is so they reduce their energy use, but we're seeing, can we do some things that has, multiple benefits. Live markets, wet markets are also a huge source of food waste. Probably 40% of food is lost in that system. Food waste is a huge contributor to climate change because that is just wasted production systems. And that is just lost to the system when you have to throw away that food. So the energy that went into producing that food is just wasted. So we can actually have hit at multiple levels here. So we're kind of working with a large group thinking about new approaches to this. And this is a company, Orbit Holdings, we've worked with. And the next slide kind of shows the scale of this. Is the massive cold storage facilities that don't depend on electricity. They use regasified liquid natural gas. So when you take liquid natural gas that's shipped around the world to produce electricity or other uses, it has to be gasified. Currently, when it's turned back to gas, all that energy is just lost. It's just waste energy. So these companies have been building huge facilities where when the liquid goes to gas, all that energy is captured and used for cold storage. So countries are actually moving, this is in Korea, they're using it for their carbon credit offsets because it requires no electricity. It provides 24-hour a day chilling and refrigeration up to -50. And so as this kind of new technology, if we can move this out, we can reduce energy use, reduce food waste, and actually help people not be dependent on live animal wet markets to get their food. So we can actually reduce their risk of infectious disease. So it's kind of a win-win-win thing. So I think, we need more of these solutions. And I like what Howie was saying, because it is the 21st century we're in. We've got a new generation of people that are really thinking big about how to solve some of these problems. And there's real world examples of what we can do. Next slide, please, to wrap up. So I just wanted to remind you at the end that these diseases don't emerge just mysteriously. It is exactly what we are doing on this planet. And we know what those sources are and what industries, which sectors we need to engage to do something about it. Next slide. And just as a reminder, the world is really different than it was for our great-great-great-grandparents. The world used to be a world of nature and wild animals. Some people kind of question the validity And they might be off by 10%. I'm good with that. But let's say they're off by 10%. The planet was covered with forest and grasslands and nature and deserts and wild animals. And today, the planet is covered with humans and livestock. And why we should not be surprised that we are seeing the changes in the health outcomes that we're seeing today when our planet is so different than when humans evolved to live on this planet. Next slide. I'm not really interested in discussing whether it's One Health or Planetary Health. As long as people are trying to do something, I'm really happy. And so we've been doing a lot of work with the World Bank to help people think through how to get different sectors. It's a confusing world of intergovernmental organization and national governments and planning tools and funding sources and regulatory, and it's all confused. So we've been really working with the bank to give a roadmap for people so they can kind of look through this. You're welcome. This is available from the World Bank. There's a new series of assessment tools, but for countries or organizations or different groups want to get engaged, you can look at this and see where's your entry point. How do you insert yourself into this system? Are you part of an expert network? Do you do a better job of reporting and sharing information and publishing? They're all important and they all need to be linked. And it's great if, rather than just kind of like arguing about which is most important, is to figure out how it all comes together and utilize it. Next slide, please. And the countries are doing this. So you have this coordination. So you have biodiversity strategy. This is all from Zambia, a biodiversity strategy, or Zimbabwe. Surprisingly, Zimbabwe. They put in their antimicrobial resistance plan. Then they do their national assessment for disaster risk. And they just kind of follow each other over the years, and you can actually link them together and work together and bring these groups together. Next slide. That's my last slide. So I'll just close with that. I think it was pretty good on timing there, maybe a little long. Apologies, JP, and open it up for, turn it back to you.
Okay. Obviously, Billy, in your last slides, you were pointing the way towards the kind of coordination and the effort that has to take place. But it seems to me on a deeper level, one of the fundamental issues we're contending with is that modern civilization is based on specialization and siloed professions, all going deep, more and more deeply into their narrow field. And it seems that what both of you are trying to do is to, in a sense, take a step back and broaden the very concept that how does one introduce that concept into the siloed professions, into academia, into government, you know, like turning all these giant ships around. So do you think there's some kind of overarching ideological, conceptual effort towards holism or broader type of thinking that needs to happen for these efforts to really bear fruit?
Well, I'll just jump in. Well, I'll just jump in and say, well, yes, of course, the answer is yes. I mean, specialization is, of course, necessary, and we've seen it as we get, you know, as society has advanced. And I would like, if, you know, forbid I ever need brain surgery, I would actually like a really good brain surgeon doing that and not a podiatrist. So I think the specialization does make sense. I think the real point is not that we need some body to force us to work together or coordinate. I'm not big on bigger bureaucracies. I think it's more about this awareness of bringing in partners to help each other. And it's really about partnerships and stuff. And I do see that happening. And so when you have a group like the bank that, you know, that works with the finance ministry, which talks across government ministries, that's one mechanism. Or at a university where they're doing more cross-training, not so people can do everything, but so they have more appreciation for people with other areas of expertise. I do think, you know, when we started with the One Health and Planetary Health, which really brought in the physician sides of getting them more engaged, I think we're still missing out on the engineering side, really engaged. I think we need to engineer solutions. We did that for 5, you know, buildings don't burn down as much anymore once we started engineering solutions, about better fabrics and smoke detectors and getting society. Private industry, the insurance industry needs to really step in and start pricing insurance based on risk reduction strategies. The risk reduction community actually has a lot to add on thinking across sectors. So I do see it happening. And you see a generation of people now in the 21st century, this next generation. I always say I was too young to be in the greatest generation of the 20th century because I missed World War I and World War II. And I'm too old to probably be the greatest generation of the 21st century. But there is a great generation just bubbling up here in the 21st century that I think is taking on these issues. And they will work together, and they are reaching out to each other. And they have different kinds of networks than I had when I was in school and taught by my professors who really had a 20th century approach to things. And I think that's changing now. And I think it's about partnerships and working together. Howard, what do you think?
Well, I completely, totally agree. I would just very quickly say education matters a lot. I think we ought to be developing educational strategies that help people think upstream, think like systems thinkers, and go into whatever specialty they choose with a broad appreciation of how what they do connects with other goals. We need to think about new measurement tools as well. So the GDP, for example, as a standard measure of prosperity, measures all the wrong things. If we go toward composite indices that measure things like biodiversity, the quality of air and water, reported levels of happiness among people, life expectancy, those are better measures of societal success. And if you go that way in your measurement, you have no choice but to think like a systems thinker and aim for composite multi-sectoral solutions. JP, are you okay there?
Electronic meltdowns, which is always even
it always happens at the worst time, doesn't it?
Like CNN and PBS have them. So yeah, no, I had my own mini version, but it's all good. It's all good. Yeah, those are. I want to now get into a few of the questions that people have been sending in, and I'm gonna. There are a number of them, but I'm gonna try to condense some of them and mix them together. And so people obviously want to know what they can do specifically in some of these areas. So some people are mentioning things like, what can people do in terms of not consuming, palm oil or hardwoods from tropical forests? What can people do in their own, professions and so on? So can either one of you offer what you think are some of the most tangible things that people in large can do to help contribute to these projects, to these initiatives?
I'll jump in. There's a very interesting debate going on now in the environmental world and to some extent in the health world, debating between whether individual behavior changes, individual choices are the right way to go, or do we need system change? And those who believe that we need system change sometimes argue, let's not focus on choosing what you eat or how you travel or how you consume, because those individual choices at the end of the day won't be enough to bring about the system change that we need. My own view is it's both and, not either or. So people in their personal lives can make a lot of choices, eating less meat than you typically eat, buying materials that you assure come from renewable and sustainable sources, be it wood or textiles or anything else, traveling by bicycle or foot instead of by internal combustion vehicle. And so those are choices that, if aggregated over entire populations, especially high consuming populations like in the US, will make a difference. They'll drive demand, they'll drive innovation, they'll reduce consumption. At the same time, one of the most important things you can do is vote and agitate and advocate for political leaders and corporate leaders to make system change. So the campaign of 350.org to get the banks to divest from fossil fuels, the campaign to get Biden elected and not Trump so that we can actually address climate change as a nation. These are extremely important. So each of us exists as an individual making choices in our own lives, but each of us also exists as a citizen, able to and obligated to push for system change as well.
Yeah, it's funny you mentioned 350.org because Bill McKibben once said, yes, it's important to screw in an efficient light bulb, but it's way more important to screw in an efficient politician. So both are true.
Right.
Yeah.
But I mean, aren't they really linked? Because if you get in the habit of turning off your lights, you might think about who you're going to vote for too. So, you got to practice what you preach, and I agree. I think it's not either or; it's both.
Do either one of you see any room for traditions of alternative medicine? Because I know a lot in the developing world, like in China, and I mean, we have, or in Africa or in Latin America, there are these folk medicine traditions that can sometimes be brought on board and be helpful, and other times, such as the use of rhinoceros horn or other things, can be very destructive. But we have a lot of people in our audience who are interested in alternative health modalities. Obviously, they're not a substitute for vaccines or brain surgery, or we all understand that. But what do you think it might be the role of these various quote unquote alternative medical traditions?
Well, I'm going to jump on the quote unquote there, JP. I don't like the term alternative medicine. I think there are only two kinds of medical treatments: those that evidence shows are effective, and those that are not shown to be effective by evidence. If the evidence shows that something works, I'm all for it. And that doesn't matter whether it's a cancer chemotherapeutic synthetic drug or an herb. If there isn't evidence to show that something works, let's not push it on people. But we should be very open to non-conventional medications. We should test them. We should ascertain that they're safe and effective. And by the way, that producing them and supplying them to large numbers of people doesn't have other downsides like sustainability issues. But once the evidence shows that it works, let's all be for it. And if it doesn't,
in an affordable way, which is going to be a big issue with this vaccine, among other things. But anyway, William, what about you? Billy, any thoughts on that, or do you not want to go there?
Yeah, I agree. I'm certainly biased to being evidence-based decision-making rather than decision-based evidence-making. So we'd like to move people in that direction. And I think, in some ways, I do think we probably over-medicate because, it's become easier and easier. So I feel bad when in the morning I go and get some drugs and take them, and maybe I would have felt better the next day anyway. So I'm wondering, so maybe some of that traditional medicine, whether it's like, take a hot bath in Epsom salts and, your body, give yourself a little time anyway to get better. So I'm wondering how much of that is just the fact that in many parts of the world, even in the US, you call your doctor, other parts of the world, you just go to a drugstore and you can get anything you want. So maybe in that case, some more traditional approaches would just reduce things like antimicrobial resistance, some of the other problems were, being generated. But we know the science shows for serious diseases, you need a medicine that really works. So there, there's the whole spectrum there that's going on. And I'm very uncomfortable as we talk about emerging diseases, and some of the big international organizations are very reticent to talk to sound like they're against traditional medicine, and that even if that involves the unsustainable use of wildlife and certain types of traditional medicine. And I think we need to have a more open and honest conversation about that instead of tiptoeing it around as if that's taboo to discuss.
Mm-hmm. So do either one of you have any thoughts about how you might get the ear of people in the coming administration to really make some headway? Because obviously we've lost quite a bit of time, and time is the thing we have the least of to address some of these issues. So are there any thoughts? Are you hopeful at all? Are there any people in the new administration who are likely to be open to these thoughts?
They already are. They're way ahead of us there. Yes, so we've got the people. That group's been talking about it from actually the same people from 6 or 8 years ago, 10 years ago.
We're dealing with the Ebola crisis, among others, right?
Yeah, and dealing with climate change and the Paris Accord, and
Right.
dealing with
Yeah. So you're optimistic on that front.
Absolutely. We still have to do a lot more. I think there's no time to be complacent.
There are very good people coming into position in the new administration. I think we can be really confident. That said, government is big and government is siloed. And so it's difficult to implement cross-cutting solutions. So, there will be senior officials tackling climate change at a cabinet level, Kerry and whoever his domestic counterpart is. I think one of their biggest challenges will be to bring about action not only in the Department of Energy, the misnamed Department of Energy. It actually doesn't lead on energy policy. It's more about nuclear weapons and energy. We need a real energy department. But we also need climate action in the Department of Transportation, in the Department of Agriculture, and Health, and Housing and Urban Development, and HHS, and so on. So I think one of the big challenges and one of the breakthroughs will be getting whole of government integrated systems-based solutions tackling the climate crisis and environmental challenges more generally.
Yeah, I agree completely. I mean, it is always traditionally been very siloed, and I'm hoping maybe we get some new thinking this time. That's a great example about agriculture. So, we know that agriculture's contribution to climate change and carbon emissions, to emerging diseases, and traditionally our USDA has been there to support the large agricultural industries and export crops. When we deal with the UN on agricultural issues, it's really focused around that, where it could be focused about climate. It could be focused, it doesn't have to be focused. It could merge climate, food security. It's not just humanitarian aid. Traditionally, our money to the UN is about humanitarian aid, and just ignored things like emerging diseases or deforestation. That's all agriculture, or overfishing, depleting the ocean's resources. That could all have an integrated approach. We are the largest donors to those agencies, the US is. So there's no reason why we can't ask for better systemic thinking on how those funds are used and do some leadership there, instead of going like, oh, it's just really about sharing more corn and rice around the world, or producing more, or let's have more cows. So I think there's a chance for that. And I'm not sure that's message. That might be a little newer in message than traditionally. I don't know. What do you think, Howie?
Well, I think that's right. But I think that we can be optimistic about progress.
Yeah.
Let me just jump in here with a related issue, because I think a part of what you were just talking about, Billy, was equity, global equity, not dictating what other countries do, but sensitively and collaboratively moving towards solutions. We have to do the same thing domestically. Yeah. I just want to reemphasize how many, especially on a panel where three of us are all male, pale, and stale, to be very aware of disparities in our society, of racism, of inequities, and of how all of the health impacts we've talked about fall disproportionately on those who are least fortunate and those who suffer discrimination. So that has to be woven into all of these solutions as well. And that means that the solutions, they are engineering solutions, and you pointed to that very carefully, Billy. They're also social solutions and changes in the way we think, so that we move toward a society that is both lower consuming and more equitable, and more future-oriented, more about stewardship and solidarity than about conquest and profit.
Mm-hmm. Obviously, one does better designing a system the more upstream one can design it, right? So that you can, the impact, or instead of just responding, you're creating conditions conducive to the right outcomes initially. But we're pretty far down the road with industrial society, so we're talking about restructuring rather than upstream design, unfortunately. Well, look, this has been, I think we only have a few minutes left. So are there any closing thoughts that either one of you have that you think are really important to drive home in this context? Any closing wisdom to offer the the desperate masses out there. No, the ideally.
Billy, after you.
Well, I don't know. I would just say try to get engaged. Try and contribute a little something, even if it's not your full-time job. If it is, that's wonderful. And if it's not, just do a little. People tell me, "Oh, what can they do all the time?" I say, just turn the lights off when you're not in your room. And I know that's what you're saying. Does that individual behavior really matter? But yeah, I think it does, in the sense of just changing our attitudes, and then that talking with our friends and family, and just kind of spreading the word. And I believe in, when we start about health, I don't think health belongs to the medical community. It belongs to society. And we have to get thinking about, and this all of society approach. So everybody gets to participate. That's how I finish.
And I'd say that's beautiful. I'd say be hopeful, don't despair. We need all of our hope. We need us to roll up our sleeves and move toward a better future. And there's reason for hope. So this is not just a fatuous piece of advice, but evidence-based hope is a powerful thing. I'd say think as broadly as you can. So if you're a health professional, think about other things than health. If you're an engineer, think about other things than engineering. All of us ought to be looking for the broadest solutions that we can. Think upstream. So Billy mentioned before that you don't just tackle car crashes by having good ambulances and good emergency rooms. You don't even just tackle car crashes by making cars and roadways safer. One of the ways to tackle car crashes, if you really push upstream, is develop transportation systems to get people walking and cycling, using transit, so that we're not in that dangerous microenvironment, the car, nearly as much. And by the way, we get lots of other benefits. Look for cross-cutting co-benefits. Think about the future. Be a good grandparent. Above all, have hope.
Well, that seems like a really good way to start to wind it down. One thing I would say, though, is that one does run up against entrenched interests in all these things. So, of course, I mean, that's the nature of human life, but some of these are very powerful. You mentioned the Department of Agriculture, and I mean, agribusiness is so important and is so overly represented politically because of our strange political system that gives small states as 2 senators in the same way as the much bigger ones, among other issues. So what do you think about that? Are there, I mean, you pointed to the idea of thinking more broadly, which I think means reforming educational institutions. I mean, it might be necessary perhaps for, in the future, physicians to have courses on ecology and social justice primers, as part of the medical curriculum, for example, but what about this, how to contend with the disinformation campaigns that are waged by these entrenched interests? I'm thinking especially of the oil and gas industry and the agricultural interests, because they've been really Machiavellian and relentless in stymieing progress on so many fronts.
Unfortunately, I don't think that approach is working anymore. And I think that's what Howie is saying too. I mean, in our choices, in consumer choices, businesses are in business to make money. And so as consumers want a different product, businesses come around. So the agriculture side, I don't want to paint that as a negative picture. I live in New York, and I hooked them up with our health department. Health department wanted eggs with lower cholesterol. The biggest egg producers in the country said, well, just give us 2 years and we can shift over our production system. We don't care. We don't have a they're kind of agnostic about what it is, as long as they can, if that's what people want to buy, that's what they will produce. So, you've seen the organic food movement expand. That was not true 20 years ago. That USDA the industry will follow what people want to buy, and they can still make money, and we can have better lives. So I wouldn't get so overly critical about any of these industries. And you see a new generation. These are young people in the energy field. This is not our grandparents who didn't care at all. It is the new generation. So I think there's a lot of hope there too. And they will come around. You talked about changing banking investments. That stuff drives change.
And I'm a little less sanguine. I can't argue with the example of egg producers supplying better eggs to a market that calls for them. But I do think that the persistent disinformation, we've seen it in the tobacco industry, we've seen it in the fossil fuel industry, and it needs to be countered not just by increasing consumer demand for better products, but also by, if I can say this, direct confrontation. Mm-hmm. So I think a lot of the campaigns to disinvest from fossil fuels, the campaigns to force investors to reckon with climate risks as they make investments, the campaigns to stop the construction of fossil fuel infrastructure, those are all as important as changing consumer demand for products. And the other piece, disinformation, we've seen a lot of it with COVID. I think the information or the disinformation ecosystem driven by Facebook and Twitter, entirely unregulated and remarkably large scale and rapid distribution of disinformation, really is a problem. I don't know the answer, but I think probably some regulation of social media, maybe even reoperationalizing how we protect and defend freedom of speech in a world where speech is a very different process than it was at the time of the Constitution being written. So yeah. Disinformation needs to be addressed.
Yeah, I mean, I think, look, it's a little unfair to expect two medical professionals to take on reforming every aspect of society in an hour and 15 minutes. So
we're really trying, though, for you.
Right. But anyway, thanks so much to both of you. This was really enlightening and I think a really good introduction for a lot of people on this broadening of the concept of human health. And I can't think of two people who've done more to push us in that direction. And thank you for, as they say these days, thank you for your service. But in this case, it's in a different context than that's usually offered. So because this is a war for survival of the planet. And in that sense, you both really made major contributions. So thank you so much. I think we're going to wind it down there because I'm told I have to end on time. So thanks again and keep up the great work and we'll be in touch. All right.
Thanks to you too.
Okay.
Thanks so much. Pleasure
Bye-bye.
being here.